Good evening. My name's Dave Newhouse, and tonight I will be your moderator. Tonight's presentation is Health Disparities in Former NFL Players, Findings from the Football Players' Health Study at Harvard University. Next slide. Tonight's presentation is being sponsored by the Public Health Alumni Association Board of Directors. This board was established in 1953 to build and strengthen personal and professional relationships among public health alumni and students of the University of California, Berkeley. Led by a volunteer board of directors, it includes several standing committees, including scholarship, events and networking, and professional development. Next slide. So tonight's presenter is Dr. Alicia Whittington, and let me say a few words about her. She is a PhD, MPH, a research scientist and assistant director of engagement and health equity research for the Football Players' Health Study at Harvard University, a comprehensive research program dedicated to addressing the health and well-being of former NFL players. She is also the co-lead of Family Experiences Managing Football Lives, a research initiative focusing on health and wellness of family members of NFL players. She earned a Doctor of Philosophy in Health Systems Management from the Tulane University School of Public Health and Tropical Medicine. She focused on health disparities, health outcomes, and sports injuries research. She completed her dissertation research on concussion education and perceptions of injury risk among high school football players. She serves on several boards, including the Yale School Public Health Alumni Board and its Emerging Majority Affairs Committee, Women Inside Professional Sports, and the Augustus White Institute for Healthcare Equity. She serves as the staff co-chair of the Joint Committee on the Status of Women at Harvard University. She is currently a student in the Masters of Science program in Media, Medicine, and Health at Harvard Medical School, which focuses on using the art of storytelling to make an impact on health. Next slide. So before we start our presentation, just a quick note on logistics. The Q&A will be at the end of the presentation. Please type your questions into the Q&A box at any time. You are muted by default, and this webinar is being recorded. So with that, I'd like to present Dr. Alicia Whittington.
Thank you very much, Dave. And thank you so much to the UC Berkeley Public Health alumni for inviting me to speak this evening on health disparities in former NFL players, findings from the Football Players' Health Study. So before getting into our research findings, I want to just give you a little bit of background about who I am and how I ended up in this space. So when I give lectures, I always say that I'm a musician, I'm a scientist, I'm many things, but at the core of who I am a storyteller. And some of the most compelling stories invite you on a journey. So I'd like to invite you on a journey this evening. So this map with stars and arrows, this is my life, which began in St. Louis, Missouri. And you can see stars where I've lived and arrows to just all the different places where I've moved. And as you can see, there are 2 arrows to Boston. But what's really interesting is that while this is my journey, my purpose was outlined before I even was born. So this slide has all 4 of my grandparents. So on the left, you see my maternal grandparents, the Bledsoes. On the right, you see my paternal grandparents, the Whittingtons. And what I'd like for you to focus on here, they're all such lovely looking individuals, but my grandfathers, I want you to focus on them because they both died in 1946 in rural Mississippi, essentially because they were Black men who did not have access to the health care that they need. Different issues with access to care, but nonetheless, they both died prematurely, leaving my grandmothers to raise pretty large families alone. And what's so fascinating to me about this, when I was a little girl, I always would ask questions about this because my parents didn't know each other in 1946. In fact, my mom was born in the Mississippi Delta in Tutwiler, home of the blues. And then my dad was born in Canton or Farm Haven, which is north of Jackson, Mississippi. And these two places are 113 miles apart. And so just thinking about what their moms endured, I have just so much respect for them. And I appreciate all of the sacrifices that they made so that I can be where I am today. But later on, my parents met in St. Louis, Missouri. And they had a plan. They always knew that they wanted to have a large family. And the plan was for us to focus on academics and music. And so just thinking about my journey to this space, and I'll share a little bit more in a minute, thinking about what health disparities are. But let's first focus on health equity. Health equity is achieved when everyone has the opportunity to achieve optimal health. And so, in a sense, no one is disadvantaged from this because of any social position or socially determined circumstances. But what gets in the way of achieving health equity? That would be health disparities, where you see a disproportionate burden of disease and health conditions in populations. And so, just thinking at health disparities, they are a major concern in our country and beyond. And then also, there are major differences in common diseases that are often found between racial groups and the general public. And so, back to my journey. When I was a doctoral student at Tulane, I remember right before I defended my dissertation, there was an announcement in the news that the NFLPA, the Players Association, the Union for Players, was funding a longitudinal cohort study, which became the Football Players Health Study. And it really got my attention because when I read about the plans for the study and their plans for incorporating the community into the work, one of the things that I said in that moment was, I don't really know about moving back to Boston, but this is exactly how you accomplish this. And I knew then that I wanted to work here. And here I am sitting before you, and it's been a little over 7 years. And so let me tell you a little bit more about the Football Players Health Study. We are the largest study of living former NFL players. We have a little over 4,300 former players that have interacted with some participation opportunity in our study. We are studying them longitudinally, which means that we have follow-up surveys and then we have other research initiatives. And one of the things that we're really proud of is that we completed what we call in-person assessments, which was a 3-day total health assessment in Boston. And so we look at not just lifespan, which is your length of life, but also health span, like how long you live before you have a health issue that affects your quality of life. And we just have so many wonderful things going on, and I'd like to share a little bit more. So about this cohort, it's pretty diverse by race. We have an emphasis on health equity, so achieving optimal health. And then we abide by the principles of community-based participatory research. And so these research objectives are actually driven by the community. And a little bit more about what that means. So here are the principles of community-based participatory research, and we can shorten it to CBPR. And so we focus on areas of health that former players themselves told us that were their health concerns. And with CBPR, there is a saying, nothing about you without you. And so you center the community in all of the work, from recognizing their importance, their community, and then you build on their strengths. And if you look at the words that are underlined, they are action words. disseminating knowledge, emphasizing, involving. So we work with the community to achieve all of our research objectives. A little bit more about that. So it requires community input at every level. And so we have advisory boards to the study, and just met with them today. And we meet with them, we discuss the science, we discuss our progress, and it's really an incredible collaboration. And it makes us better scientists to hear from the community and to get their input. We also engage in the community in a way where we prioritize building trust. We listen, we learn from them, we're available to them. And one of the later slides, you'll see that we have contact information where if former players have any questions, we are always available to answer those. And then we focus on the community givebacks. So that would be returning results. And then we attend events, just like this evening. And we also host events, we travel to events. And one of the things that we're really proud of is that we worked with the community to create a framework for returning results. And so the framework is in 3 parts. And that's what the science says and what this may mean for a player. And then we provide action steps for players and resources if they want to learn a little bit more about whatever results we're sharing with them. And so I'll get into some of those results. So we published a paper on race disparities and player health. And when it comes to health disparities, also called health inequities, you can see things like differences in length of life, quality of life, rates of disease, disability, and death, the severity of disease, and as I mentioned before, access to treatment is critical. And you may be wondering why study health disparities in former NFL players. What's really interesting when you think about decreasing health disparities or reducing that burden, things that come up in conversation would be the advantages that people would associate with being a former player. And so things like education, because there is an education requirement, they all have at least some college. There's a higher median income. There's prestige and social status associated with a career in football. And then they are elite athletes. And while playing, they have access to healthcare. And so for this particular paper, we looked at 5 health outcomes and by race. And so the former players actually self-identified, and we categorized them as Black, white, Hawaiian players, and other races, and multiracial. And you can see that those groups are a little bit smaller. So I'll get to that in a minute. And the 5 health outcomes that we analyzed were physical impairment, pain interference in daily life, symptoms of depression, symptoms of anxiety, and cognitive impairment. And what you see under each area of health are samples of the questions that you would find in the surveys that we send to former players. So getting into some of the results, what you see here are the frequencies at which the former players report each health outcome. And what you see here at a glance, so the navy blue bar represents the Black former players. The sort of teal bar in the middle represents the Hawaiian and others. And then the red bar represents the white players. And what you see is that the Black former players are worse off across all 5 health outcomes than their counterparts. And so just going a little bit further with the analyses. So Black players were 36% to 86% more likely to have poorer health outcomes in each area when compared to their white counterparts. And then looking at the other non-white players, they were 25 to 64% more likely to have poorer health in each area. And when you see results like this, you wonder what could be driving these differences. And so we began to control for different factors such as race differences by playing position, the number of years they played, body mass index, the number of games they started, using pain medication, and just different things that you would think maybe would have an impact. However, none of these factors changed the results. And then we even looked at era of play, because the more contemporary eras are thought to be more progressive, with more Black coaches, higher salaries, and still the results did not change. And so getting into some of our other results, looking at health span. So one thing that former players, and I mentioned that we listen to them, they've shared with us that they feel older than their actual age. And so some define their age not only by the number of years that they've been alive, but also the way their bodies feel. And so the number of years that you live, that's your lifespan. And as I mentioned before, health span is when you get to the point where there's a health condition that affects your quality of life. And so we wanted to know, are former players experiencing early aging? And in short, yes. So we compared the former players to men in the general US population. And we found that they not only have lower health span or decreased health span, on average, they're losing about 10 healthy years. And why is this important? Former players live as long, if not longer, than everyone else. And so we can all hypothesize about, just what happens when one has a chronic health condition. It can be very costly, and it does affect quality of life. And we also have studied race disparities in chronic pain. And just looking at chronic pain, it is quite prevalent, and it is also very costly. And you can see here just the impact of it. It can lead to or be associated with other health issues, whether it's some form of disability, then healthcare cost. It's quite costly, as I mentioned, sleep disturbances, depression, anxiety, and a decreased quality of life. And what's also important to mention is that pain is what we call biopsychosocial. And that means that there are biological aspects of pain, the social aspects of pain, and the psychological aspects of pain, meaning the thoughts, the trauma, coping behaviors. And so these three areas are really important. And if you ignore one of the areas, you're actually not even looking at the whole issue. And so what did we find? So these are former players who I self-identified as either Black or white. And we found that the Black former players report higher pain intensity, higher levels of pain interference, meaning that the pain that they live with interferes with their quality of life and just daily activities. And earlier, I showed the map of the US and my journey. And one of the things that we've talked a lot about in one of my courses this semester is just looking at the historical context of how things happen. So a group of colleagues and I, we collaborated with sociologists out in Utah, and we wrote a paper called, it looks at the paradox of integration, the racial composition of the NFL, looking at position data from 1960 to 2020. This paper is one that's really special to me because, senior author on it, but also the amount of data that we had to work with. So there were well over 20,000 players included in this data set. And we actually use a sociological framework to look at it, to focus on patterns. And in the slides that I'm about to show, essentially the main message is that You may see diversity, but that does not necessarily mean inclusion. And in order to understand historical context, we actually looked at just events in history, policy changes, and things that happened outside of the world of football that had an impact on labor. And so you see here just, the pre-1960 era, and it's really important to mention that at one point, Black players were not allowed, or Black athletes were not allowed to play in the NFL. And so these are, this is just looking at 1960 to 2020. What you see here, so the salmon bars are, those represent the former white NFL players. And the purple bars are the Black NFL players. And on the left, so going from left to right, what you see is that over time, from 1960 to 2020, the composition of the NFL has gone from predominantly white to predominantly majority Black over time. So just stopping to think there, you may think, oh, wow, it really has diversified over time. But when you take it a step further and you stratify or break it down by position, you see some interesting results. And so we observed 3 patterns. And I'll spend a minute or so to talk about these. So, and we called them by 3 different names. So you have the positions that actually integrated over time. So those would be the offensive linemen and tight ends. And that means that over time, in terms of, would it be a white player or Black player in those positions, pretty even. Also, we have what you call cumulative hyper-segregation, where there was a change over time from going from predominantly white to majority Black. And you see that in positions such as the defensive backs, defensive linemen, linebackers, the running backs, and wide receivers. And for those of you on the line who really know about football and the functions of those positions, I'm pretty sure you're thinking, okay, I have an idea of what could have potentially happened. Very interesting. And the third pattern that we noticed is durable segregation, which would be the quarterbacks, the kickers, and punters, which have remained predominantly white over time. And just looking at the sociological literature, we found, and this is directly from the paper, that Black players tend to be channeled into positions that are characterized by lower visibility and status, but also with higher physical demands, which comes with a higher risk and fewer opportunities for leadership on and off the field. They also face greater scrutiny when compared to white players during the draft process. And they are routinely confronted with racist stereotypes about their criminal history, proclivity for violence, and extended family obligations. And let's go a step further with the quarterbacks, which I mentioned they experienced durable segregation. So Black quarterbacks are described in ways that emphasize their physical strength, but yet lack of intelligence. While white quarterbacks are described as less physically gifted, but more mentally prepared for the rigors of professional play. And also, Black quarterbacks are routinely rated lower on leadership, intelligence, and decision-making compared to white athletes by NFL draft experts, thereby reinforcing barriers to entry into professional sports, particularly for Black quarterbacks. In all things, though, while working at the Football Players Health Study, I am encouraged. We always share information we learn with a message of hope. And as I've shared that I am a storyteller, one of the things that I like to share is that it's really important for me to do this work, because not only is it my life calling, but I'm a scientist and I am a sister to former athletes. So this is my brother, Bernard, and he played in the NFL for 9 years and actually walked away his 10th season. And I'll just read the quote from him. He said, "It can be overwhelming to think about health disparities on top of all the other issues players face. Former players know what they experience and how they feel, and those outside of football may not truly understand it. And data from the Football Players Health Study is validating. I continue to learn helpful information that I share with my friends." And I thank my brother Bernard. But also, football is not only a community sport, it's a family sport. And I'm number 7 of 8. And 3 of my brothers played football. And you see great helmet hair here. Daryl played at the University of Missouri at Columbia, and my younger brother, Aaron, played at UCLA. And they followed in Bernard's footsteps because, well, football is fun to them. And then they just all have this incredible work ethic. And I share with my colleagues and also when I speak at conferences that my lived experience is just as important as my training as a scientist. And it's really fun to be able to apply, lessons from my life and from school to this work. And here's some other pictures for you. You see there's a Cal uniform there. UCLA, I do believe, lost that particular game. And then the upper right, second from the right, it's my brother, Bernard, tackling your favorite Dancing with the Stars champion, Emmitt Smith. And I mentioned that football is a family sport, and we've all rallied around my brothers to support them. And it's been so rewarding to see their careers flourish and even life after football. And I'd like to acknowledge those that made this possible. Former players and their families are essential to this work. We could not do this without them. Also, our advisory boards to the study, we have 3 of them, former players and family members, and also Family Experiences Managing Football Lives, another research initiative. We have a panel of advisors as well. The NFL Players Association, the NFLPA, as we call them, graciously funded this study, and we are independent of the PA. Also, many thanks to the staff and faculty, our collaborators, and thank you to the UC Berkeley Association of Public Health Alumni for inviting me this evening, and then my family and friends who may be on the line. And if you would like to learn more about the work that we do, there's so much available on our website, which is footballplayershealth.harvard.edu. And we have what we call the 5,000 line. We have an email address, and we are available on every social media platform at Players Study. And I dedicate every talk that I give to my mom. She just, she's the general, I call her. And she supported me throughout all of my journey, becoming a scientist. And when moving all over, she and my dad supported everything that I did. And I'm just eternally grateful. And here she is pictured with John Madden, and the both of them are pioneers. So thank you so much.
Great. Well, oops. So thank you for that talk. So we have some questions coming in now. Do you have anything from the data that suggests why Black football players do have more injuries?
Well, this is when I wish that my brothers could be here to talk about their experience. And this is something that we hope to better understand over time. And let's see here, I'm trying to. Gosh, that is a difficult question to answer because football has changed over time. And what you see are differences in policies to protect athletes. You see protective equipment because we don't want them hurt. And to be continued.
Okay.
I feel like athletes should answer that one.
All right.
Yeah.
Here's another non-controversial question. Do you feel that the NFL has shirked raising awareness of health disparities or assisting players to establish retirement solutions or continued education, aftercare for NFL-related injuries? If so, what suggestions would you provide?
I can't speak for the NFL. The interesting thing is that when you have the data, you can support players in a better way. And what we've seen over time is that there are several organizations that actually provide various resources to former players. Some of them are dependent on your experience in the NFL, like how long you've played. But there are a lot of resources. And I believe that as we learn more about former player health and their experience, and this is why it's important to actually bring them to the table to discuss their concerns as we're going through the data, as we are doing the research, so that we can help them advance health equity.
Okay. So what do you think is the first step to seeing improvement in health equity for former NFL players? I mean, this study is probably one of the first steps. What would you see as a second step?
You know, I did not mention it, but the first paper that I talked about was actually the very first paper to look at health disparities by race more broadly in former players. Before then, it hadn't been done. And so taking those steps, and I mentioned my lived experience has been informative. It's really been so useful when we sit down to talk about how we analyze the data.
Okay. There's been not very many Black coaches. Do you think that having more Black coaches would make a difference? And also, did you happen to look at not just the coaches, but the staff that support the coaches? Are there discrepancies there as well?
If you invite me back in a couple of years, I'll be able to answer that question. But this is, in all seriousness, an issue that is really important to me. So last year, I believe it was the Washington Post had a series looking at coaches over time. And we're still pretty early on with our data. And I think that the more people who come to the table, so if there are any scientists out there that are interested in this, especially prospective graduate students, let's work on it together. Let's make it happen.
Okay, so I don't know if you can answer this one or not. Why do quarterbacks have more injuries given their position?
Actually, quarterbacks are a protected class. And my brothers would probably laugh at me for trying to explain football. But I remember when I was working on my dissertation research over 10 years ago at Tulane, and that was my thought too. And I was looking at concussion, knowledge and education, and perceptions of injury risk. And I assumed that quarterbacks would, produce the most injuries. And the data set that I was looking at in terms of concussion experience, they were lower than the running backs and wide receivers.
Okay. Is there a pay discrepancy between races in the NFL? And I don't know if you looked at that. And if so, could that be a reason for some of the health disparities?
I am not an economist. However, it could be one of the motivating factors for some of the things that you see. We definitely would need an economist. And I know a great one that could probably answer that question.
Okay. Next question. How are players recruited into the longevity study? And what's the attrition rate? And what keeps players on the study for a long time?
That is an excellent question that I can actually answer as an epidemiologist. So in terms of the inclusion criteria for the study, all a former player had to do is sign an NFL contract. They don't even need to have made it beyond training camp. And I have had the experience of just, learning from the community, and some have asked, well, my career wasn't that long. Why would I be of any asset to this study? All athletes that make it to that level are elite athletes, and there are so many things that we can learn from them. And we do lots of different things in terms of community engagement to remain connected with the community. We offer any of our faculty and staff to present to groups. We'll do that over Zoom. We engage with the community and building trust with the community. And our advisory boards are all over the country, and they are some of the greatest ambassadors for this work. And we always look for ways to improve as well, though. So we'd be happy to hear any suggestions.
Yeah, do the players tend to stay on the study for a long time?
Well, we are relatively young for a longitudinal study. Next year, we will celebrate 10 years.
Wow.
And so we hope so. That's my answer. We hope so.
So this will be an ongoing study, I take it.
Yes.
Okay. I'm not sure if you can answer this one, but how are mixed race athletes tabulated? Oops. And same with the Pacific Islanders.
They are self-identified with the data from the Football Players Health Study, where former players actually fill out the questionnaires. Now, with the larger analyses looking at NFL, the race composition from 1960 to 2020, we actually purchased that data from a source that collects that information, and they have a very extensive means of collecting race data. Okay. But for the purposes of those results that I presented with health disparities by race, those were all self-reported.
Okay. An earlier study showed the hypertension, high blood pressure, one of the leading causes of cardiovascular diseases, is more common in NFL players than in a comparison group of non-NFL players. It is also well known that Black people have higher rates of hypertension and cardiovascular mortality than whites. Are you looking at these medical outcomes in your study, or are there plans to look at them?
I am so thankful to whoever asked that question because as I mentioned, I am a storyteller, and science tells a story. One of the papers that we published earlier this year looked at head injury and hypertension, and there is an associated increased risk of hypertension if a player has experienced head injuries. Also, I mentioned lifespan. The majority of former players actually die from a cardiovascular related health outcome. And so please stay tuned, because we are working on these things. We have an interdisciplinary, multidisciplinary team that are working on these things.
Okay. Is healthcare access and services the same for Black players? For example, orthopedic specialists, time recovering from injury, rehabilitation, et cetera?
That is an excellent question. And as I mentioned, we are still very early on, and I truly hope to be able to answer that question, because that is something that is incredibly important to me. Because access to care makes not all, but it makes a huge difference. It's critical for achieving health equity.
How does this very constructively revealing and rigorously respectful research get applied to the executive and administrative awareness and effectiveness in being a part of positive change, closing the gaps, the danger factors, the psychological disregard? Administrative and executive refers to team owners. What is the feedback that you get from the team leadership? That's a lot there.
I love the crowd that's here this evening. That's an important question. As I mentioned, we're funded by the NFLPA, which is the Union for Current and Former Players. The funding for this research actually was the result of earmarked dollars from collective bargaining agreements. And so that shows that they were interested in learning about former player health. We're still very early on, but we regularly share our findings with all of the stakeholders. And I hope to maybe be invited back sometime soon to maybe give a little bit more feedback on the progress we've made. But please know that we have shared these findings, and we shared them in detail.
Okay, I just lost a couple of questions here. Has there been any interest in focusing on college teams?
Love this question too. There are other studies focusing on college teams, and because we're funded by the NFLPA, that's why this study focuses on former NFL players. But when you think about epidemiology and exposure, and we view this as an occupational cohort, NFL players, in terms of football exposure, in most cases have more than those that did not play beyond college. And in short, yes, people are studying college players. And if someone wants to follow up with me, I can share some of the really cool things that are happening around the country. And you all will be very excited to have this conversation in 5 to 10 years. I promise you the work is happening.
I was wondering if eventually you might even take it down to high school level to studying, what is the impact of playing, football in high school or even at a younger age?
Actually, that's what my dissertation was on, and it opened my knowledge base to another level. So I looked at data after Louisiana passed the Youth Concussion Act in 2011. And this particular legislation provides concussion education and awareness so that if any youth sports program through high school abides by the principles of the legislation, if an athlete becomes injured, the program is not legally liable for whatever happens after that. And the Sports Medicine Education Committee from the Louisiana High School Athletic Association, I probably, mixed up some of the words there. They surveyed athletes in Central Louisiana, the North Shore, and in New Orleans to get an understanding of what they knew about safety and their perceptions of protective equipment and their risk of injury. And also they asked many questions about if they experience certain concussion symptoms. And then they asked about their playing exposure. And they also asked them, have you experienced a concussion? So when looking at the entire data set, and I believe there were 631, about 11% of them, a little over 11%, said that they had experienced a concussion at some point. Okay. And then I took the analyses further, and I looked at whether or not they experienced certain concussion symptoms, from headaches and dizziness, which tend to be the more common ones, to fainting, blacking out while playing. But then there was another question that intrigued me, which was, did you continue to play after you experienced those symptoms? And that was the big, whoa moment for me, because looking at those symptoms, between 2 and 258 continued to play with those symptoms, but they said they never experienced a concussion. And so those are the athletes that the legislation was designed for, because those were potentially misdiagnosed, or not misdiagnosed, but missed concussions rather. And if you count those as having concussion experience, that would bring concussion experience in the data set to well over 53%. And when you look at youth athletes and brain development, so your brain doesn't reach maturation until you're between the ages of 25 and 28. And these are youth athletes. What is happening? So that is a concern.
Wow.
I spent a lot of time with that project. It's well over 200 and something pages.
Wow. Next question. I am curious to see if there was any focus on mental health impact and outcomes during post NFL, not only on players, but on family, loved ones that was captured, or if there are plans in the future to do so. I would love to see this. Contribute thoughts as one with family members who are former NFL.
Yes. As I mentioned, we have a huge focus on working with the community and being a little sister to athletes. This is one of my passion projects, the families and how they're affected by just the entire experience and supporting a player. And for about 5 years or so, I met with community members and received phone calls, emails, and they would ask, have you thought about, studying the family members because they have unique needs as well? And I'd always wanted to do it, even, when I was working on my dissertation back at Tulane. And this presented an opportunity to work with the community to create FemFL, where we are asking about mental health. We even have COVID experience questions in there. We ask about career trajectory, education, things like that, that are associated with various outcomes. And in short, give us about a year or so, and you'll start seeing some of that data. And I hope that you all will follow us on social media, because we do post things there. Also join our mailing list, because we will have webinars coming up. We're actually about to kick off some hypertension awareness events and a huge campaign, and you will not want to miss those events. I promise it's going to be great. Can't tell you all that's going to happen, but you'll love it.
Another question here. What are some prudent solutions to develop a more even situation for retired players that are minorities?
Wow. Excellent question. First, you have to understand the scope of the problem. And with our study, I mentioned that we are the largest study of living former players. And while we have over 4,300 that have participated, there are probably well over 25,000 that live somewhere in the US or abroad. And so the more we can get former players involved, the more we hear from more of them, the more we can understand the true scope of their concerns so that we can best help them. And that's another thing. This study is for the players, by the players. And that is at the forefront of everything that we hope to do. So if you all know any former players, please share that this incredible study is happening and that it is for them, and we'd be willing to share whatever information they need from our website and our publications and results returns.
Yeah.
Also, another thing to mention is that we are developing tools to help former players and their families when navigating the healthcare space. Dave, thanks for reading my bio earlier. My doctorate is in health systems management, which is about how people access healthcare. And we have all of these incredible results that really show us the gaps, the burden of disease throughout the former player population. And oftentimes you'll hear that, after a career ends, a player may or may not know how to navigate the healthcare system. Many things about the NFL experience in terms of healthcare may be curated for them, and it leaves them in a position where there's a vulnerability. And how do you maximize your relationship or your visits with your physician? And so we've created a couple of things, actually. One is called Make a Game Plan for Your Health, and these are available on our website. All of these things are free, and we're in the process of finalizing a checklist. And this checklist is designed for you to, you can either scan it with a QR code, or you can print it out and take it with you to your doctor's office. Another thing to mention is that our results returns, we worked with, as I mentioned, the advisory boards to create the framework for returning results, but they are meant to really help the players. And we encourage them to print them out and take them to their doctor's office. We hope to get this information into the hands of clinicians and those who care for players, because it's really important to increase knowledge and awareness of this work and how we can help former players advance health equity.
Did you set any goals for impacting the owners, the executives, and administrators?
I did not personal goals, but I can share a nugget that one of my professors mentioned this week. When it comes to just fulfilling your purpose or walking in your purpose, keep doing the work, believe in the goodness of people, and things will progress. And I think that given our approach to the work, given how much we care and we work with the community, that we can change some hearts. Because working here has changed my heart in a way that I'd never thought it would. And for those that are asking if I'm doing this work because of my brothers, no, not exactly. Love them to pieces, but there's another lecture that I give about that that involves a broken foot.
Do you think that the higher level of injuries might be related to perhaps poor conditioning or possibly higher underlying rates of disease?
In terms of the conditioning, that would be a question for athletic trainers and clinicians. In terms of the chronic disease piece, and I would highly encourage you all to go to our website. We published a paper looking at ACL tears in former players. And this particular paper, we found that those that experience an ACL injury are more likely to experience arthritis later on in life, and then they're more likely to need a knee replacement. But we found a mild association with having a heart attack. And it's just borderline statistically significant. But that's really interesting because you think of, this injury, tearing an ACL. And for some athletes, that is the beginning of the end of their careers. But when you experience an injury like that, it can change how you live, whether or not you're able to exercise, mobility, things like that, and put you on the path to health status changes that could increase your risk for a heart attack.
Yeah, I remember a quote by John Madden. He said once that after your first contact hit in football, your body's never the same.
Wow.
Just to remember that being repetitive over game after game after game.
Well, you think about how the human body is designed. Your brain is sitting in fluid.
Yes. So here's another question. Do you think there was self-selection in the study by players who might have been injured versus those who are already relatively healthy? Could that have had an impact on who signed up for the study?
I love this question because I tap into my training in epidemiology. So we are very fortunate to have some of the most incredible senior faculty who have a lot of experience with this, creating the more historical cohort studies. And there's ways that you can ask questions. And these are health surveys that actually ask a bunch of different questions. If there are any former players on the line, they maybe have seen them, but there's so many things beyond just demographic data. And we ask about not only their health experience, but we ask about things like experiences with discrimination, early life experiences. And that's one thing that I did not go into further. The social determinants of health piece is really important. And so for those who that may be a new term. So social determinants of health, where you live, work, play, you're educated, where you're born, the situation into which you're born. You hear work about zip codes and how they are linked to health outcomes. So we have a lot of great stuff going on.
So I think we have one last question here.
Sure.
Do you see your research study unfolding into a long-term initiative run by an NFL accredited and NGO? And if so, should such an NGO be a particular interest of HHS government?
Wow. I'll share this story from my late mentor, Dr. Gay Culverhouse. I actually read her book when trying to figure out how to work in this space and used her book and her life's experience to create the theoretical framework that essentially made my dissertation happen. I remember her telling me about how she testified before Congress. She was like maybe the first person to do so, to talk about injuries in football, and specifically head injuries, concussions in football being a silent epidemic. And when also learning about the history of football, sports injuries, and advocacy that's been taking place in this world of sports, it has been a lot of grassroots approaches that have made tremendous impact. I think about Zachary Lystad. In every state, there are a set of Lystad laws, is what they call them. So Zachary Lystad was a young athlete in Washington State who was injured in a football game. They took him out for a little bit, but they put him back in the game, and he is permanently injured. The Traumatic Brain Injury Association in Washington State, which was run by a physician at the time, and then other advocacy groups, the moms have been really powerful in this space. They lobbied, well, they pushed for legislation rather, and they were able to get that passed. And when I started working on my dissertation, not all states had a form of legislation. And in terms of it being NFL accredited, like the research being run by it, I really like the model that we have, which is being independent from all of the sort of, influences. Because at Harvard, we are separate from the NFLPA. We are funded by them, but we come together for the love of science and caring for this population and all of the various scientific, clinical, research backgrounds that we have to advance health equity for the players. And I can speak firsthand about it being such a dynamic team, and they have found the top experts in the world, and we've come together with the community to really talk about these issues, and I hope that we can continue to make incredible progress.
So we have a comment here, no
Yes.
question, but I came to support Dr. Whittington. She is a gem here at Harvard.
Oh.
So with that, I want to thank you for a fascinating and illuminating presentation tonight. I want to thank the audience for some very thoughtful and thought-provoking questions that they asked over the last 20 minutes. I want to thank the Alumni Board for sponsoring this presentation. And I want to thank Nahari Patel, who was monitoring the chat box. So with that, I wish everybody a good evening, and I hope to have you back in the future to do a follow-up on this talk.
I'd love to.
Oh, great. All right. Good night, everybody, and take care.
Good night.